With us tonight is most of our staff, aside from Dr. Jeroma, who is one of our naturopaths, and Rebecca Rice, who is one of our licensed acupuncturists. So we'll start from the left side, my left. Jen Mager is our nurse practitioner at the Stram Center for Integrative Medicine. She has over 15 years experience as a registered nurse, and she has over 10 years experience in oncology. Chris Riley is one of our licensed acupuncturists at the Stram Center, and he's actually been with us since the inception of the Stram Center 10 plus years ago. Dr. Carl, we actually met Dr. Carl when she was in school as an undergrad, well, as a graduate, she's a naturopath now. She's one of our other naturopaths. She came to shadow Dr. Stram and Dr. Jeroma at the Stram Center, and we had the opportunity and the pleasure to welcome Dr. Carl back. Next is Amy Gordon. She is our registered nurse. She's also a yoga instructor, and she practices Reiki. Next is Jim Whiting. We are joined by, he is a certified Kripalu yoga instructor. It's a tongue twister. He also is our meditation guy. He guides our meditation on Wednesday nights at the Stram Center, and he is also a Reiki master. Next is Chris Fisk. You guys met Chris. And Holly Ahern, who is a microbiology professor at SUNY Adirondack. Next, we're joined by Sue Coughtry. She is our licensed massage therapist at the Stram Center. She practices a multitude of different massages, and they're all wonderful. She's also a Reiki master. And finally, we're joined by Eric Scherer, who is a registered dietitian, and he also has a bachelor's degree in culinary nutrition. He has worked with the prestigious Block Center for over 5 years. And then, of course, you guys know Dr. Stram. All right, so we will start with reading the first question of the night from the audience. This person is getting treated for cancer, and could that treatment be preventing infection, is the question.
Interferon is an immune enhancer. It's actually put out by your body. The interferon that you typically get for cancer is an immunosupportive, it's an immunostimulant. Is it possible that it may be preventing an infection? It's possible, but it's also possible that this individual has that HLA haplotype that would make them less responsive to a tick infection or Borrelia infection. And one of those, the HLA-DR4, which is what I mentioned, is the bad one to have that makes you more likely to have a long-term chronic infection. The better one to have is number 11. So the HLA-DR11, and I don't know, but it is possible that both of those together may be making it that you're not getting it. We also know that there are people that do a lot of work outside and do not get the disease. Just like there are people that have HIV disease and never really get sick. So there are people that are fortunate to not have the expression of the disease.
All right, thanks, Dr. Stram. The next question is, what are the ELISA test / Western blot test? They want to know, is this a blood test or what type?
To answer that question, they are blood tests. The ELISA and the Western blot are both blood tests.
And that can be prescribed by your primary.
So the ELISA test is an immunofluorescent test. It looks for the DNA of the bacteria. It is, like I said, a less sensitive test. The Western blot is essentially what it does is it takes the blood and spins it down, puts it on a gel, and lets it grow up. If it reacts to the antibodies, then it will rise and make a band. Typically, you take the bacteria and you cut it up into maybe 10, 15 little pieces. And that's where the bands come from. They're based on the weight of the pieces that are cut up. So band 41 means it's 41 Daltons, kilodaltons. That's the weight that they use, just like ounces, this is just a weight. 34, 39, those are just the weight. And that's just that's the manifestations of the different pieces that are cut up. Is that helpful?
All right, the next audience question is, having finished a 4+ year regimen of antibiotics, can you recommend a detox treatment to eliminate the die-off from the body?
Some things that may be useful for you is cutting out certain foods. I can speak on behalf of the dietary interventions, and the team can speak on other things too, but certain things we've seen effective through a Stram Center in my own practice as well is cutting things out like gluten. One of the main proteins found in certain things is big in wheat. Also cutting out dairy products. Limiting your sugars, cutting out sugar as well. And really getting on sort of a anti-inflammatory diet. Really trying to cut back on things like beef and chicken, really increasing your fruit and vegetable intake, increasing your plant-based proteins. Doing that will certainly help to detox the body and promote the liver to start pulling things out. You also do things like juicing or green smoothies, which really increases the fiber from the green smoothies. The juicing really helps to pull things out as well. So really, you can look into different options. There's a lot of things out there. I think it's going to be guided in that process because there's a lot of different things you could try. But first, try elimination diet to see where you're at and see how that feels for you.
I would actually like to add that lymphatic drainage is another wonderful way to add to your detox. It's very gentle, it's very light, and it allows the body to flush toxins out of your system.
I would second that too. I was just going to say that same thing. But also, in addition to that, one of the things that I see with patients doing the best with antibiotic therapies and getting die-off reactions, herxing, is supporting the liver and just the gastrointestinal tract in general. It's one of our main ways that the body eliminates toxins, and so supporting the liver with certain herbs, milk thistle is an example, castor oil packs, so applying castor oil to the abdomen, especially in the right upper quadrant, to really promote the liver's ability to detoxify. Probiotics help the gastrointestinal tract eliminate, as well as the fiber that was already mentioned.
In addition to the detox question, there was also a question that I read on one of the index cards. Somebody asked about glutathione IV pushes. We use at the Stram Center IV push glutathione as both a detoxification protocol as well as a diagnostic tool. Oftentimes, when patients have a very robust response to an IV push glutathione IV push, we recognize that as there being a lot of die-off and that there is a big need for detoxification in that patient. Glutathione is probably one of the most prevalent antioxidants in our bodies. It's so important, in fact, that there are probably over 70,000 articles in medical journals written about glutathione. So that is another way also that supports the liver and is a pretty powerful tool that we use to help in the detoxification process.
And some of it too is a case-by-case basis. Like detox is a really big term that covers a lot of ground. So we would want to look at how this specific individual is going through their detox. Are they getting more joint inflammation? Is it more a skin issue, neurological issue? If it was primarily neurological, there's a set of things we would do. It's primarily inflammatory. We would, in addition to the diet detoxing the liver, we would bulk up the anti-inflammatory herbs. So it can be a really specific question as well, which is really patient-specific, and probably each person out here has their own story, so we can't go into every possible specific treatment plan. But in addition to these kind of broad things, we would want to do specific patient picture items as well.
Excellent, thanks guys. That was a loaded question. As you can see, a real integrative approach is probably the best way to take. So let's look at the next question. First, they said thank you. They said, I live in a high incidence Lyme neighborhood. Should I take annual antibiotics as a preventative method, or in case it is undetected?
From a microbiology perspective, it really taking random antibiotics, well, and I don't mean random, just as a preventative measure when you don't have a risk of infection, you are promoting antibiotic resistance in the bacteria that live within your body, which then serve as reservoirs of those genes that they can pass to other bacteria that enter your body. So just as in general practice, that's probably not a great idea. It would be far more important to just be really vigilant about checking yourself when you come in, looking for ticks, taking any off immediately. You can also, when you come indoors, take a shower immediately, put your clothes in the dryer. You don't even have to wash them if you don't want to, because the dry heat does kill ticks if they are on your clothing. Those types of avoidance mechanisms are far better than taking antibiotics.
As far as looking at the internal picture is concerned, Ron mentioned a lot at the beginning, not just treating the infector, but also the infected. So, if you want preventative items, just look at your overall health picture. Make sure you're eating well, getting enough rest, your immune system is as strong as it can be, and just be vigilant so that any signs that do occur don't go unnoticed so you can catch it early. But rather than the overuse of antibiotics, we do just want to take really good care of ourselves, have our immune system functioning properly, and hopefully in the case of an infection, we are aware enough and cognizant enough to where we'll notice the signs early and get treatment as well.
From a preventative point of view, we've become aware of a product called Detox tick tubes. And these are little cardboard tubes that you can place around the perimeter of your property. And what happens, I haven't followed the mice around, but what's supposed to happen is that they go into the tick tubes and they pull out little bits of cotton that are treated with permethrin, and they bring it to their nest. And the treated cotton will kill the ticks, doesn't kill the mice, doesn't kill the wildlife. It's not great for fish, so it shouldn't be used near water. But it's called Detox tick tubes.
Great advice, guys. All right, so did you guys have anything else to add before? All right. So for some more specific questions, can arthritis symptoms begin in 5 days after a tick bite?
Yes, absolutely, they can. Even sooner, right?
Yeah, and basically, essentially as soon as you develop a rash, that means you have systemic Lyme. I mean, it's not, if you got bit and then you develop a big rash, that means it's already in your system and it's creating a histamine response. Within 3 to 5 days, yes, you can absolutely get arthritis symptoms, you can get headache, you can get all the symptoms of Lyme within that quick of a period. That tends to mean that your response is rapid and that you're having a rapid immune response. Sometimes that's a good thing because that means that if you get treatment, you may affect the outcome sooner than later than if you have an indolent course, right? It's just slow. You got a little joint pain here, you don't know if it is. It's much easier to, again, kill something that's active. And really, to echo what Holly said, is that testing is very inadequate because it is just the response of your body in producing these antibodies. Unfortunately, those people and those patients that go untreated for years and undiagnosed for years often have now a limited immune response, and therefore their response to testing is less accurate. So your response to getting a Western blot test may be negative or may not have enough band counts to make you CDC positive. And that is the pure limitation of the test. There was another question about the culture. The culture test means you have active Lyme disease. Now, you may not be super sick, but it means that it grew out active Lyme disease. If the Lyme culture is positive, that means the bug was in your blood. It's not a piece of it, it's not an antibody response, it is a culture test. So I hope that